Hi guys, so this is the first part of the anatomy of the upper limb. So in this video, we'll be talking about the shoulder muscles, okay? So the muscles of the shoulder are nothing but the rotator cuff muscles. So there are 4 rotator cuff muscles and each of the muscle has different function to the shoulder. So these all help in the movement of the shoulder. So to remember the rotator cuff muscles, this is the mnemonic SITS. Okay, so supraspinatus, infraspinatus, teres minor, because this is minor, therefore a small t, and subscapularis. So as you can see in this image here, this white part here is the spine, okay, spine of the scapula. So the muscle above the spine, supraspinatus muscle, therefore supra is nothing but above, spinatus above the spine, therefore supraspinatus muscle, and the muscle below the spine is the infraspinatus muscle, the blue one here. Alright, and this is the teres minor, and this, if you can see, is the subscapularis muscle. So subscapularis is nothing but sub means under, so therefore this muscle is under the scapula. Alright, so these are the 4 muscles of the rotator cuff. So S for supraspinatus, I for infraspinatus, T for teres minor, small t, and subscapularis for S for subscapularis. So now let's talk about the functions of these muscles. So abduction, AB, alright. So abduction is nothing but your, you've heard of abduct, right? So somebody has abducted you. That means somebody has taken you away from your home. Therefore, abduction means the person is trying to take his limb away from his body. Alright, as you can see, the limb is moving away from the body. And adduction, AD. Adduction means he's moving his limb towards his body. So these are abduction and adduction. And this here is external rotation, where he's externally rotating his shoulder. And this is internal rotation because he's internally rotating his shoulder. This here is going externally and this is going internally. Therefore, external rotation and internal rotation. So supraspinatus muscle helps in the first function, that is abduction, because A, B are the first 2 letters of the whole alphabets. Therefore, S, that is the first muscle, helps in the first 2 things, that is abduction. And then external rotation. Infraspinatus helps in external rotation. Teres minor, because it is a minor muscle, it doesn't have any significant function. And subscapularis helps in the internal rotation. Because E comes before I, right? A, B, C, D, E, F, G, H, I. Because E comes before I, therefore, infraspinatus helps in external rotation and subscapularis, that is the last muscle, helps in internal rotation. So again, SITS. Supraspinatus helps in abduction, AB. Infraspinatus helps in external rotation because E comes before I. Infraspinatus helps in external rotation. T doesn't have a significant function because it is a minor muscle. And S, that is subscapularis, helps in internal rotation. Alright, so these are the rotator cuff muscles.
So after you wake up in the morning, the first thing you need to do is sit. So SITS, the mnemonic is. So S for supraspinatus, infraspinatus, teres minor, and subscapularis. So the first thing you do when you wake up in the morning is abduction. You do like this, right? So this is known as abduction. Then you do like this, which is known as external rotation. Then for doing some work, you need to bring your hands from here to here. Okay. Then you do something which is known as internal rotation. So abduction, external rotation, internal rotation for doing some work. Okay.
If the patient has any issues with these muscles, or if there is any issue with the shoulder, the patient might present with shoulder pain. Alright, so the associated pathologies with the shoulder are rotator cuff tears, subacromial impingement, calcific tendonitis, and the 4th one is frozen shoulder. So now let's talk about the associated pathologies of the shoulder. So the first one is rotator cuff tears. So as you can see in this image here, this is the supraspinatus muscle, right? And there is a tear here, this tear. So this is the rotator cuff tear, alright? So supraspinatus muscle has been torn here. So this usually follows after a trauma or any kind of thing. Somebody hit you, or you hit somebody, or you fell down, or you have been in an accident. It could be anything, because of which there has been a tear in the rotator cuff muscles. It could be any muscle. Here it is the supraspinatus, but it could also be in your other 3 rotator cuff muscles. subacromial impingement. So impingement is nothing but when just say B is supposed to be occupied by B, the letter B, but just imagine B being occupied by A. So then there is no function of B, there is no function of A either. So something else is occupying the space of one thing. That leads to impingement. I'm sorry about the confusion, but you'll understand better with this. So as you can see in this image, this is a bony spur. So a spur is nothing but this is a bone. The bone is slightly getting, protruding out like this. So this is nothing but the bony spur. Okay, so as you can see here, this is a bony spur here, this one. And this here is the acromion of the scapula. And the space below the acromion is the subacromial space or the subacromial bursa. Right? So acromion, this here is the subacromial space. So when this bony spur occurs, this is doing what this is doing is it is pushing the bone towards the space, and the space is getting narrowed. Right? So it should technically be occupied just by the space. There should only be subacromial bursa, and the space should be enough. Right? So this the space should have been like this, but now because of the bony spur like this, the space is being reduced like this. Right? So this reduction here is the impingement. Right? So because of this impingement, the shoulder will not be able to move itself freely. Right? So there will be some issue with shoulder movements. So this is nothing but shoulder impingement. So right under this tendon, as you can see here, this is the supraspinatus muscle, this is the tendon. So what a tendon means is, it is the connection between a muscle, say this is the muscle and this is the bone. So this connection here is the tendon. So as you can see here, this white structure here you can see, this is the connection between this muscle and the humerus bone, right? So this is the tendon, and this tendon usually lies right next to the acromial bursa, the subacromial bursa that we just spoke about here, right? So what happens is when there is shoulder impingement, it leads to inflammation in this tendon because of its anatomical structure. Therefore, that would lead to supraspinatus tendinitis. Alright. So supraspinatus, as we have already seen before, it helps with abduction. Right. So abduction, you can do it yourself. Just try to lift your hands over your head. Alright. So when you're trying to lift your arms over your head, it'll cause abduction. I mean, it'll need abduction. Alright, so this abduction is going to be impaired or slightly problematic in these patients with inflammation in supraspinatus muscle, because that is the main muscle used for abduction. Therefore, narrowing of the subacromial space causing supraspinatus tendinitis. The patient will have pain and weakness of the shoulder muscles, especially during overhead activities that would include abduction. Alright, and the patient will have restriction of that activity. And this kind of thing is usually seen in patients with a history of repetitive overhead activities or carrying heavy weights. So for example, say a weightlifter. So this guy, the guy who keeps lifting the weights, because of all the abduction that he has to do, there is a lot of strain being put on the supraspinatus muscle. Therefore, those kind of patients are more prone to this disease. The next one is calcific tendonitis. So this is nothing but calcific. So there is calcium. There is going to be some calcium buildup in the rotator cuff tendon. Okay. So as you can see in this image here, this is the X-ray, and this here is the calcium buildup. Alright. So it's like a calcium plaque. So this is occurring in the rotator cuff tendon. That is the basically supraspinatus tendon. So this will again lead to the same pathology as subacromial impingement. And the next one is frozen shoulder. So frozen shoulder is also called adhesive capsulitis. So we all know that the shoulder joint, this whole joint, is a ball and socket joint, right? So just say for example, this here is the shoulder and this here is the humerus. So these two are connected with a ball and socket joint. So this joint is nothing but the glenohumeral joint. So gleno is the glenus capsule of the glenus bursa of the scapula, and it will come here, and this is the humerus, right? So this joint is the ball and socket joint. This blue color joint that you can see here, this one is the glenohumeral joint or the ball and socket joint. So this patient with frozen shoulder, this is occurring because of thickening and contraction of this joint, of this glenohumeral joint. Alright, so all these contractions are going to eventually lead to formation of adhesions. Okay, so as you can see here, this is the adhesion. So because of these adhesions, the patient will have obviously a thickened capsule here. Because of that, there will be restricted movements. And the patient is also going to have stiffness because of these too many adhesions, too many capsules, too many things going on here. The patient will have global stiffness. The patient will have pain and stiffness of the shoulder. Alright, and he'll also have restricted movement of both active and passive. He is unable to move the shoulder at all, be it active, be it passive. Whatever movement it is, the patient will not be able to move because of the whole restriction in the complete ball and socket joint. So the management for this condition is pain control first, and then physiotherapy, and then steroid injections. So the steroid injections can only be given twice. Okay, only 2 steroid injections can be given in this patient. So that is, the management is the same for any pain in the shoulder, any shoulder pathologies. Firstly, it will be pain relief with NSAIDs or paracetamol, and then physiotherapy, steroid injections too, and then if nothing else works, as a last resort, you'll get the patient undergo a surgery. So this surgery is done only when the any of these pathologies has not improved with steroid injections or physiotherapy. Right? If nothing else works, then surgery is the option. So this is all about the shoulder. So shoulder muscles and the shoulder pain and the associated pathologies with the shoulder. Alright, thank you.